Welcome to the Hinckley Institute of Politics, a nonpartisan institute at the University of Utah. The Hinckley provides an array of transformative experiences for students through internships, forums, and classes. Hinckley forums seek to foster public discourse and civil debate on the most current and pressing issues, bringing in local, national, and international thought leaders. Thank you for joining us for today's forum, Poison and Policy, 65 Years of the Utah Poison Control Center. Jennifer Napier-Pierce, Editor-in-Chief of the Salt Lake Tribune, will introduce today's speakers. Please join me in welcoming her.
Good afternoon. Thank you so much. It's a pleasure to be here with you on National Pharmacy Week. How many of you knew it was National Pharmacy Week? I'm delighted to introduce our first speaker. The format for today's forum will be about 10 minutes with our first speaker, about 30 to 40 minutes with our panel. We may entertain some questions. We'll close promptly at 1 o'clock. Today's forum, Poisons and Policy, 65 years of the Utah Poison Control Center. It's my great pleasure to introduce Dr. Anthony Temple. He's a pediatrician and medical toxicologist. In 1971, he joined the faculty of the University of Utah College of Medicine, where he served as director of the General Pediatric Ambulatory Care Clinic and as director of the Intermountain Regional Poison Control Center. In 1979, he joined McNeil Consumer Products Company, where he helped to develop regional poison control centers and training of specialists in clinical toxicology. He served as a member of the board of directors and president of the American Association of Poison Control Centers and is on the boards of the American College of Medical Toxicology and the American Academy of Clinical Toxicology, many other prestigious positions, and he's received numerous awards. He's also served on the Utah Poison Control Center Advisory Board since 1998. So if you have any questions about institutional memory, this is your guy. He served as board chair in 2004, again in 2010, and he continues as a senior medical consultant to McNeil. He's also an adjunct associate professor in the University of Utah School of Medicine. Please welcome Dr. Anthony Temple.
Thank you. It's really a pleasure for me to be here. I'm one of the few people old enough to talk about this topic. So the intent here is to give you some really important historical background that will make you understand why the Utah Poison Center is so special. Let's start. Did I trip the right one? Yes. Let's start with the history of the U.S. Poison Center movement in general. How long have poison centers been around? They've been around since 1953. In 1953, Dwight David Eisenhower was President of the United States. And I was in the early years of junior high school here in Salt Lake. That's how long ago that was. During the early 50s, pediatricians and health department specialists were worried about poisonings and how to deal with them. And so a group of them got together and created what was the original Poison Information Center in Chicago, officially opened in November 1953 at Presbyterian St. Luke's Hospital. It became sort of the foundation of a movement that rapidly spread across the United States. In 1954, here in Salt Lake, perhaps the second, maybe the third, the old-timers argue about who was second and who was third, the Poison Center opened at the Salt Lake County General Hospital, which was the clinical teaching center for the University of Utah School of Medicine. Some of you may or may not remember that hospital. It was on 21st South and State Street. And it stayed there for quite some time. Because there were so many poison centers happening, the federal government decided that they would try to step in and help out and formed an organization called the National Clearinghouse for Poison Control Centers. It was a way for the federal government to collect information, disseminate it to centers so they could provide information to their clientele. Now, what was the clientele? The clientele at that time were other physicians, and this was primarily physicians or nurses in emergency rooms or hospitals calling these centers to get information about the contents of a product or maybe some advice on how to treat a poison center, a particular kind of poisoning, I mean. Now, this the National Clearinghouse put together a very sophisticated, for the time, 5x8 card system. Can you imagine? I mean, and I can still remember using them, to be perfectly honest, because they were around for quite a while. Each card was a product, had product information. That's what you had, and that's what you worked with. It later was supplanted by very sophisticated electronic systems, including, and the clearinghouse also tried to collect information on poisonings, but that didn't survive. And the American Association of Poison Control Centers, which was established in 1958 as a professional organization, took over the data collection system in the United States ultimately. But during the 1960s, the initial poison center director really put Utah on the map. The first poison center director was Alan K. Doan, a physician, pediatrician, professor at the university, and was a director from 1954 to 1971. He was a very talented, very determined scientist. He collected cases of aspirin poisoning, salicylate toxicity, and created and put together a nomogram, or a blood level diagram of how risky the amount somebody had ingested took place, and became the standard for management. But his poison center was an old style poison center. He was the poison center. And if he wasn't there, whoever was in the emergency room that could go to the box of cards answered the call. In 1965, the Salt Lake County General Hospital closed. And it left very quickly a need for a new place for the poison center to go to, and so it followed right along to the new poison center the new hospital up on the hill, right above us. And at that time, the emergency room was at the south end of that three-tiered building, and the poison center was put in there in a storage room next to the emergency room. Just as a point of context, it was still a consulting service with a card file and no full-time phone service staff, even then in 1965. The School of Medicine, class of 68, that's the class of medicine I graduated in from the University of Utah, was still in its preclinical phase on lower campus. So I was totally oblivious to what was going on in those days with the Poison Control Center. But along the way, I was introduced to Dr. Doan in my graduate work as I was working through medical school. Became a student in his labs, and when I finished my pediatric residency here, he gave me some special training in toxicology. And so in 1971, when I finished, I took sort of a joint responsibility with him, and then he shortly after that left, and I became the director of the Intermountain Regional Poison Control Center. Now, what was interesting was that during that brief period of time, in those couple of years before 1971 and this time, there were 600 poison centers in the United States. Some of them answered one call a day, some of them a couple of calls a week, some several calls a day. But until there was a centralized call center where everybody called at the same location, the expertise was never going to develop. So Dr. Doan and I determined that we would call ourselves a regional poison center and pretty much advertise ourselves throughout Utah and southern Idaho and western Wyoming to try to attract people to call one place so we would have the experience. And you'll see a couple of the little education pieces. It's a little hard to see it, actually, but it does say the Intermountain Regional Poison Control Center on there. We tried very hard to create the concept of regions. But the real step forward didn't come until a little later on in the 70s. But the medical school and the pharmacy school decided to form a partnership to train and use pharmacists as full-time staff. Now that was a big change. What that meant was we hired a couple of pharmacists to work as clinical people in the poison center, and then PharmD students who were taking rotations took a rotation through the poison center, and they staffed the phone. And now we had full-time staffing of the telephone by a core group of people who became experts in toxicology. And I believe that full-time staffing was the major breakthrough that made poison centers become the wonderful public health service that they became. Those four pictures to the right, one is Dean Swinyard. He was the dean at the time. And Hillman Castle was chairman of Community and Family Medicine. He was one of my two bosses, and they were the ones who were willing to pull together this joint effort. And the picture is me and Joe Veltri, who later became the director of the Poison Center. He was like our first PharmD student that came through the program. And down below is what the old Poison Center looked like. It was a lot of books and still a few cards at that point. So it was still lacking in some of the toxicology resources that are now available. But during the 70s, one of the things that transpired through poison centers all over the country was that it was important to increase public awareness so that you would get decent utilization of your services. And so things like National Poison Prevention Week, there's a picture up there of when Governor Matheson signed the National Poison Prevention Week proclamation. In the background there, you'll see a lot of the Poison Center staff standing around. If you look at the small table taken from that article, it shows that the Utah Poison Center in 1972 took 5,600 calls. So that's a little more than 15 a day, something like that. But by 1976, we were taking 20,000 calls a day, and you'll see that now the Poison Center takes 40,000 calls. I'm sorry, not a day, a year. Well, 20,000 calls a day, that wouldn't be too hard, would it? No, of course not. And because of what transpired here at the Poison Center, the Intermountain Regional Poison Center established a model which was utilized by the American Association of Poison Control Centers to remake poison centers across the country. And those criteria are shown on the right of the slide. You wanted to create a center of expertise and excellence. And to do that, you had to have centralized facilities and information. And you had to work hard at that because a lot of people wanted to still just keep a poison center in the emergency room just because. But to try to convince them that they would get better service with a more centralized facility became a public relations endeavor. Part of the reason it was successful is that we had full-time staffing, and people knew we had full-time staffing and knew they would get good service. And then added to that, data collection and analysis, because if you don't take advantage of the experience you have with a poisoning problem, you can't learn from it. And because we were at an academic institution, we were interested in the science as much as anything. In addition, professional education and consumer education took place, and part of that was to simply encourage people to use the center, and that's what happens today. If you ask the Poison Center what their top community priority is, to get the phone number out so that people know who to call and where to call and what to do about it. So, but in 1979, I moved on. I left the Intermountain Poison Center and went to work for McNeil, as you heard, because they had a project to provide Poison Center grants and fellowships. The Poison Center grants were to provide money to help start up regional centers on the Utah Poison Center model. Now, why would this is a pharmaceutical company. This is the company that makes Tylenol. Why would they do that? Because the president had a problem with a poisoning episode in his family, and he called the local poison center in New Jersey and was not happy with the outcome and the results, and decided that they had to be able to do a better job of building poison centers, and they would contribute to that. So over the first 3 or so years I was there, we managed to fund 20 poison centers, plus provide special attention to Philadelphia, the Philadelphia Poison Center. And I also talked them into providing grants to train people. So if you don't have trained physicians and you don't have trained specialists, pharmacists in the case we were training, you don't have the skill set that you need in a poison center. So we trained a lot of people. We trained 20, we provided money. I didn't train them. We provided money to train 24 physicians and 10 PharmDs over the next about 3 to 5 years. Now, in the picture you see in the lower right-hand corner, some of you will see familiar faces. There's a person standing right on the very left of the picture, Barbara Crouch. Then not Crouch. She became Crouch after that. But that's who that is. She was one of the fellows trained at the University of Maryland, and her mentor is the third person in from the left, Gary Oderta, who many of you remember came here to the University of Utah and ran the clinical therapeutics department. I'm not sure the department. Yeah, okay. But and he was a wonderful pharmacist who provided a lot of service in Maryland and here. The other thing that happened during that period of time, early period of time, that made me realize how important poison centers were, was an event that happened to the company I was involved with. It was the tampering that occurred in Chicago in 1982. It was a big deal. A lot of people were scared. They were worried that every bottle of Tylenol in the whole country was poisoned. And so the question is, what do you do when you get called about a Tylenol death that doesn't look like acetaminophen overdose? Well, that's exactly what happened. The people in Chicago who were seeing these 7 cases that died were concerned that this didn't look like traditional acetaminophen overdose. So they started calling around. They called a couple of places. One of the places they called was the Rocky Mountain Poison Center in Denver. And one of the faculty there, staff, actually was a physician resident or physician fellow, said, I don't think you're dealing with acetaminophen overdose at all. I think it's cyanide. And suddenly it changed the whole way people began to think about that. Now, his boss, Barry Rumack, shown in the white hair below, he didn't have white hair then, but and I happened to be in a meeting in San Francisco at that time, and we were called, him by his poison center, me by my company, saying, get to Chicago. So I flew to Chicago. Barry got into gear and helped us decide that these were cyanide poisonings. And the story, we don't need to tell the rest of the story, but if it hadn't been for the poison center interface, we might have gone down a long, bad trail for a long, long time. And we were able to go find product in the marketplace that had been tampered with and take it off the shelves because we knew what we were looking for. So, great story of what a poison center can do. Well, since that time, you've now heard the whole old story. I'm just going to say that I've been here. There's been a continued growth in the poison center here. Barbara came after she was a fellow. She went to Philadelphia, where I knew her there, and then she came here and has been the director for, she said, just under 30 years, but she's been here for just under 30 years and has been a tremendous leader. There's been continued growth. Compare the 20,000 in 1976 on the left with the 2017 data from the American Association of Poison Control Centers that they reported in, 39,000, and now it's 40,000, over 40,000 in the last couple of years. There's been a tremendous growth, and what can I say? The Utah Poison Center has really made a difference. It's number one, it's saved a lot of lives here in Utah. It's saved a lot of money because you can prevent people from going to the emergency room that don't need to be there. You can give them better care for less cost once they're there. and they provided this wonderful service, and they now sit in a much nicer, high-tech room in the pharmacy building. That's all. Thank you.